What about people who go beyond 10? Oh, I have seen some clinicians literally get what I would describe as angry with a patient who says their pain is 11 or 12 out of 10. It doesn't make sense to me. Why are you getting angry? No, the scale is up to 10. Maybe your 10 isn't strong enough. Maybe I've said it's terrible pain, but what they're actually experiencing is something beyond terrible. Maybe I've said a 10 is the worst thing they could imagine. This is worse than they could imagine. I like this. I actually took this from a comment thread on a website. Someone was talking about the 0 to 10 scale. And this comment, I can't even find it anymore. It said, at a 10, I'm saying I require immediate relief of this pain as it is currently intolerable. So in that case, 10 is intolerable. I can't take it anymore. Don't doubt me. Just help me. However, if I tell you an 11, I'm afraid I'm going to die from this pain. If I give you a 12, I'm afraid I'm going to live. That seems fairly powerful to me. So, if we were to talk about how really to use and implement this scale clinically, my suggestion to you would be, first of all, to choose an anchor that makes sense to you, that should be fairly high, something that people really shouldn't go beyond. However, if they do go beyond, explore that a little bit. What does that mean? You gave it an 11. Why'd you give it an 11? It's really high. What's that mean to you? This is worse than I could imagine. I would rather be dead. I am, in fact, thinking of killing myself. Better make sure that you explore that a little bit further. Okay. I want to show this to you because I think this is rather interesting. So a few years back, I wrote a chapter on pain assessment for the American Hand Society, a textbook that you can purchase online. And one of the things I went and did was looked at normative values for just the numeric rating scale across a variety of different conditions. We can see here we've got people with low back pain, patients with musculoskeletal pain, neck pain, with hand and wrist disorders, painful diabetic neuropathy, rheumatoid arthritis even. Now what's interesting, the arguable exception perhaps of rheumatoid arthritis, although it's still close, is if you look at the mean values across these conditions, 5.8, 5.8, 4.6, 4.5, 4.4, 4.2. What's the midpoint of our scale is 5, right? When you see a mean value that is precisely the midpoint of a scale, it means one of two things. It means, one, this is the most impeccably designed scale that you can get because it's a perfect sort of Gaussian distribution to your scores. Boy, this single item 0 to 10 scale is the pinnacle of scales. We should have just stopped there. Or it means something else. Now you think about it for a second. If you were to ask me to rate my pain, go back to this idea of a transaction here. If I tell you my pain is too low, then there's a risk you're not going to treat me. If I tell you my pain is too high, then there's a risk you're not going to believe me. So if you've got me defended well on the left and the right, what am I going to do? I'm going to hit it straight up the middle. And I truly believe this is the kind of thing that's happening here. And what's remarkable here is actually I've looked at more of these since that time. This is a couple of years ago. What's also amazing actually is look at the standard deviations. They're all almost exactly 2. I've done, and what's interesting, if you look at the next pain-related RCT or something that you look at, and I am reasonably confident that you will find a mean of 5 and its standard deviation of 2. That has to mean something beyond this is the best scale that's ever been created. So think about that as well when you're asking these scores from your patients. I mean, for one thing, you're saying, I want you to take the breadth of this experience and boil it down to me to a number between 0 and 10. That in itself is a daunting task, right? But then going on from there, I need you to think about what I've just told you what 10 is and how you understand my 10. You need to think about how you're rating that based on what you think I need to hear. It's not uncommon, some of you will have had this experience where your patient comes in the first day, they say their pain is an 8 or a 9 out of 10. And you're the 5th person that they've come to see about their pain. And you spend time with that person, and on your first day, you validate their experience, and you develop a rapport. And you say, I believe you, and here's what I'm going to do to try and help. But the next day they come in, and now their pain is a 4 or 5. Chances are, that's not a function of some unbelievable treatment that you gave them the first day. But what they've done here is they've communicated the message. They've said to you, I need help. Okay, now I know you've heard me. I told you my pain was 9 out of 10. You've heard me. You've validated my concern. You may be arguably getting something a bit more accurate the second. So just something to consider.